Hello everyone, welcome to sqadia.com. I'm Hina Khan and today the topic of our lecture is child homicide. Now, while defining child homicide, it's basically the murder of a minor that comes under this definition. So, the minor is defined according to the legal constitution of any country that we are talking about, but usually it's the age under 16 years that comes under the definition of minor. So, the murders of the minors come under the definition of child homicide, and its investigation is carried out in a very specific way. We'll be basically looking out for the sign and symptoms accordingly to this definition, and that is basically the main crux of this lecture. In the first section, we'll deal with the stillbirths and the live births. Now, while we differentiate between the stillbirths from the live births, stillbirths is basically the age of viability, that is the 24 weeks of gestation. According to the definition, any child that is born dead below 24 weeks of gestation, that comes under the definition of stillbirths. And how do we differentiate it from the live births? It is the mainstay over here, and we'll discuss its incidence and the role of a pathologist for the diagnosis of stillbirths as well as the diagnosis of the live births is equally important. Now, stillbirths, live births, and its separate existence. Now, separate existence is another terminology that is used, and we'll be discussing that as well in this section. Concealment of birth or trying to hide a stillbirth is another phenomena that comes under the legal definition, and we'll be discussing that as well in this section. Moving on to the second section, we'll be discussing the autopsy on suspicious death. The autopsy appearances are discussed mainly over here for the dead birth or the stillbirth as well as the live birth of a baby, and then external examination of cord and placenta. So how are you going to diagnose basically the stillbirth and differentiate it from a live birth? That is the mainstay over here. Working as a medical legal officer who delivered a stillbirth, one should be knowing, even if one is not working in the field of forensics, one should know how he or she should differentiate a stillbirth from a live birth. And then the examination of abnormalities, the examination of the fetus after the birth, it's again very important. Moving on, in the third section, we'll be describing the types of injuries that can occur after a child homicide has taken place. And it can include different methods. For example, strangulation and smothering is sometimes referred to. Smothering basically comes under the definition when the airways are blocked from the outside. For example, the openings, the nostrils, or the oral cavity is basically blocked, and that basically comes under the definition of smothering. Then we'll be discussing the cutting and the piercing phenomena. So the piercing with the help of needles into the fontanelles, and that is sometimes quite hidden in the infants because the fontanelles are not quite well formed in the infants, and so it is only diagnosed on the radiological examination. So the head injuries are again quite common in infants, and drowning is another phenomena that can be referred to if one is committing the child homicide. In the fourth section, we'll be referring to the proof of separate existence. So once the separate existence has been established, one can advocate the circumstances as the live birth, and then the advocate or the lawyer will basically start on with the consequences. Now, the infanticide by the omission to offer the proper care. It's again very important that working as a medical legal officer, if it's a live birth, how can you provide the proper care to the infant? The hydrostatic test on the lungs, it's again for the viability of the child. And the inspection of fully and minimally respired lungs. They're again very important. Now, in the fifth and the final section, we'll be dealing with the histological appearances of the lungs especially, just to attain the viability age. Now, the histology of the sequestered parts, they're again very important, and the role of the resuscitation. So even if the child didn't take the first cry, the role of the resuscitation is again very important over here. And then we'll be dealing with the estimation of maturity, and how can we estimate the viability age as well as the maturity of the newborn. That is again very important. So I hope you want to learn more about child homicide. So do watch the other sections of this lecture as well.